So we are going to do a setup for an oVEMP test. And so the first thing we're going to do is prep our patient. We're going to use new prep to prep. And so I'm going to squirt just a little bit of that onto some gauze. I like to have 3 little sets of gauze here for the forehead and for the eyes. And so when we go to our patient here, I'm going to start on the forehead. So we'll go right in the middle of the forehead here. And you want to put enough pressure when you're doing it that you're really cleaning the skin so that the electrodes stick on well. And you want to make sure that these are really dry also so that the sticky part of the electrodes actually sticks on. And then when we do it on the eyes, I'm going to go right here underneath. I'm going to have her look up. And so what I'm going to do is put it really close, and I kind of go from the bridge of the nose underneath, and I kind of continue in that motion here. Still want to put a lot of pressure. We don't really want to do a lot of back and forth here. So I go in the same direction outwards from the nose. And then we'll do the same on the other side. I'm just going to go the other direction here. I'm going to go here and move outwards. You want to be pretty close underneath the eye because we're going to get as close as possible when we place our electrodes. Again, putting a little bit of pressure, make sure everything's nice and clean. And then I'm going to grab a tissue just to make sure everything's nice and dry so that our stickers stick really good. I'm going to go under the eyes one more time. Okay, great. So we're prepped. So what we're going to do next is place all of our electrodes. We have a 2-channel electrode montage set up here. And so I'm going to take my ground electrode. When we do oVEMP, it's in the opposite position. So normally ground is low forehead. We're going to place the ground electrode on the high forehead. I'm going to place my vertex electrode, and this is specific to the Interacoustic Eclipse. It's going to go on the low forehead. Again, when you're putting the electrodes, you want to make sure you push around the outside, not in the middle, because you'll push all the gel out. And then I'm going to do, with an oVEMP, it's a contralateral response. So I'm going to put it the opposite. So when you put the inserts in, you'll have your red insert on the right ear, but that is measured from the other eye. So I'm going to go underneath the left eye to place the red one. So I have her look up. I'm going to come right under the eyelashes and put it right in the middle. The goal here is to get the gel right underneath. I also slide this up and try to tuck it behind her ear a little bit. I know we've got a lot of electrodes going, so I try to tuck some of these up and out of the way so it's not quite so much in her face. You can even clip this to the other side if we need to so that they're out of the way. Then we're gonna do the same on this side. So the left, you'll have your left insert set up on this side, and then we're gonna measure it from the right eye. So again, she's gonna look straight up. I'm gonna go right underneath the eyelashes and place it. You want that gel, again, right in the middle underneath so that we're getting that inferior oblique muscle right there, because when she does an oVEMP, she's going to be looking up, which pulls the muscle closer to the electrode. So once we're set up here, we also want to set up our inserts. So we'll just clip those on both sides. We'll plug in one at a time for whichever you're testing. So if we're testing the right side, we'll plug in the right ear. And so once all of that's set up, we'll check our impedance here on the box, and then we're ready to run our test.